Dr. Kazmi here. Let's talk about causes of rectal bleeding in children. The most important first step? Know your age groups, because the likely causes vary dramatically depending on whether you're seeing a neonate, a toddler, or a teenager. Let's start with infants. The number one cause is anal fissures, often due to constipation. But don't forget milk protein allergy, a common cause of allergic colitis that presents with blood-streaked mucousy stools in formula-fed babies. Then there are the emergencies, intussusception, which shows up with current jelly stools and intermittent colicky pain, and necrotizing enterocolitis in preterm infants. In toddlers, anal fissures remain the most common cause, but juvenile polyps and Meckel's diverticulum also become important. Polyps cause painless intermittent bleeding, while Meckel's can present with sudden, painless bright red bleeding, often under age 2, and infectious diarrhea or foreign body trauma should also be considered. In school-age children, rectal bleeding may result from juvenile polyps, inflammatory bowel disease, especially with abdominal pain, weight loss or fatigue, or persistent anal fissures, but examination is essential to rule out hemorrhoids or solitary rectal ulcers, particularly in those with chronic straining. In adolescence, your differential has to widen. Polyps and IBD are still contenders, but now we need to gently probe into more sensitive areas. Sexually transmitted infections, self-injury, and eating disorders can all cause rectal symptoms. A systematic approach, starting with history, exam, stool features, and targeted investigations, is key, but if a well child has minor bleeding from a visible source like a fissure, conservative management is appropriate, while persistent, recurrent, or systemic signs warrant referral. Now, a word about red flags. If a child presents with large volume bleeding, hemodynamic instability, altered mental status, or severe abdominal pain, this is a medical emergency. Conditions like intussusception, volvulus, NEC, or significant coagulopathies must be excluded fast, stabilize first, investigate later. Rectal bleeding in children is usually benign, often due to fissures, but a vigilant, age-specific, and systematic approach, combined with clear parent education, is essential to avoid missing serious pathology. Hope you have learned something. Like, subscribe, and share, please. Thank you.